Hi, thank you for your comments. They are very encouraging. The pandemic wave is relentlessly progressing. Almost every family seems to be affected, with one or two members reported positive. Tomorrow, India is going to embark on its expansion of the vaccination coverage. 18 to 45-year-olds are also to be included. I know that many of you have already been vaccinated, especially those who are senior members of the society. But whether you are vaccinated or not, you still have to follow the COVID protection or COVID protocol, that is, safe distance, mask, sanitization. Vaccination is the fourth part of the armament against the virus, which will try to break the chain. Now, vaccination is to teach the body's immune system, the defense system of the body, how to recognize the foreign organism which is dangerous to the body. We have been vaccinating children for many years now, and we have a lot of experience, and we know that they are safe. The currently available COVID vaccines in India, Covaxin and Covishield, are also very similar to some of the vaccines we are already using, like the rabies vaccine or the flu vaccine or the hepatitis vaccine. Now, the way the vaccine works is like antivirus software. So antivirus software, what it does, the moment the virus comes, it eliminates it. So similarly in vaccination, when the virus enters our blood system, the immune system eliminates it. The immune system works 24/7. Whether we are sleeping, we are active, we are on holiday, we are young, we are old, it always gives us protection immediately. And there are many people who don't believe in the vaccine. They are the anti-vaccine category, and their presumption is that, okay, if the disease comes, then we can treat it and tackle it. But they forget that the immune system works instantly, spontaneously, 24/7. The moment the virus enters, it tries to eliminate it. Whereas if we don't have that immunity developed by the vaccine, then we have to wait. Maybe it might take 3 days, 5 days for the symptoms to show up, and by then it might be very late and the person might be very unwell. So vaccination, when available, is always a good strategy to be on board. Now, the two vaccines, the COVID vaccines that are available, Covishield and Covaxin, are very similar. They don't cause any disease in the body, they only produce antibodies. And their method of producing antibodies is slightly different. In Covishield, it helps to produce antibodies against the spike protein. The spike protein is a projection from the shell of the coronavirus, which is like the nose. So in Covishield, it produces the antibodies to that particular protein. Whereas in Covaxin, it uses the whole shell of the killed virus, so like the whole face. So other than the nose, other parts of the virus, if they are recognized by the body, that will still help to eliminate it. Now both vaccines are very effective. That means they produce more than 50% protection, which is what the WHO said that the COVID vaccine should have. In fact, they are saying that they have 70 to 80% protection. And the vaccines have very little side effect, sometimes pain in the local site or mild fever or body ache, etc. One of the vaccines was reported to have clotting problems. That also has been followed up and found to be extremely rare, almost 4 in a million. That is a very, very small number in comparison to the number of people who are getting affected by COVID and becoming dangerously ill. What is very well known is that one dose of the vaccine protects, and 2 doses of the vaccine definitely protects even better. It definitely helps people avoid going into hospital, into the intensive care, ventilator, and death. It also helps to reduce in a great extent the long COVID symptoms spread over weeks and months. And it helps quite a lot in reducing the chances of getting infection into our throat and our body. So the mild symptoms are also reduced quite a lot. So the bottom line is, when you get the chance, please go ahead and get vaccinated. The other point I wanted to stress upon is that pregnant and lactating women are still not considered as part of the vaccination program in India. This morning, the FOGSI, the Indian Federation of Obstetrics and Gynecology, has recommended to the government that pregnant and lactating women should be also included as part of the vaccination program. They form the big chunk of this 18 to 45-year age group. The reason why they were not included in the vaccination program is that there is no evidence of the vaccine administration in them. It is quite normal not to include them in the vaccination trials because nobody would try something new upon pregnant women and other vulnerable people, like those who are cancer survivors or those who have serious illnesses. Now, we know that from other parts of the world that many pregnant women and lactating women have had the vaccination and they are being followed up. 90,000 women in USA and several thousand women in UK and other parts of the world. Until date, nobody has reported any bad side effects either in the women themselves or in the child. In the case of lactating women, there is no harm at all because it's only the antibody that is developed in the body of the woman, and she might at best pass on the antibodies through the milk. So that's also good for the baby. Now, in case of pregnant women, pregnancy itself is thought to be a risk factor for serious disease with COVID, especially those who are in the later stages of pregnancy, in the third trimester, and there is a high risk of premature delivery. Now, if anybody takes the vaccination right just before conception or in the early weeks of pregnancy, still there is not thought to be too much harm that would happen to the woman or to her developing fetus, because it's only antibodies that are going to be developed by these vaccines. That antibody is not going to alter the DNA either of the woman or of the fetus, nor it should cause any organ damage. If you are so concerned, you can take it after 13 weeks of pregnancy, when most of the body development of the fetus would have already happened, as we do for flu vaccine, etc., which are given in slightly later parts of the pregnancy. Now, those women, pregnant women, who have additional risk factors, like they are having hypertension or diabetes or asthma, or they are above 35 years of age, or they are overweight, are having double risk. So one is with the pregnancy, then is all these comorbidities. So they are being encouraged to take the vaccine even more by all the international federations of obstetrics and gynecology. So the bottom line is the vaccines are safe and they are very beneficial, and don't worry about the minor side effects, because the problem of getting the infection and suffering through the illness is much worse than these minor side effects. So I wish you to be safe, be healthy and happy. Thank you.